Burns and electrical injuries. In this video, we will talk about burns, actions to take for small burns, actions to take for large burns, electrical injuries, actions to take for an electrical injury. Burns. Burns are injuries that can be caused by contact with heat, electricity, or chemicals. Specifically, heat burns are caused when a person comes in contact with a hot surface, hot liquids, steam, or fire. The only thing you should put on a burn is cool water and clean dressings. Never use ice. It can damage a burned area. Follow any further instructions by a healthcare provider. Actions to take for small burns. Make sure scene is safe. Get the first aid kit. Wear PPE. Cool the burn area immediately with cold, but not ice cold, water for at least 10 minutes. If you do not have cold water, use a cool or cold, but not freezing, clean compress. Run cold water on the burn until it does not hurt. You may cover the burn with a dry, non-stick sterile, or clean dressing. Actions to take for large burns. Make sure scene is safe. If there is a fire, the burn area is large, or you are not sure what to do, phone 911. If the person or their clothing is on fire, put the fire out. Have the person stop, drop, and roll, then cover the person with a wet blanket. Once the fire is out, remove the wet blanket. Carefully remove jewelry and clothing that is not stuck to the skin. For large burns, cool the burn area immediately with cold water for at least 10 minutes. After you cool the burns, cover them with dry, non-stick sterile, or clean dressings. Cover the person with a dry blanket. Check for signs of shock. A person with a large burn should be seen by a healthcare provider as soon as possible. A healthcare provider can determine if additional treatment is necessary. Electrical injuries. Electricity can cause burns on the outside of the body and on the inside, injuring organs. You may see marks or wounds where the electricity has entered and left the body. The damage can be severe, but there's no way to tell how severe based on the marks on the outside. Electricity can stop breathing or cause a deadly, abnormal heart rhythm and cardiac arrest. If an electrical injury is caused by high voltage, like a fallen power line, immediately notify the proper authorities and phone 911. Do not enter the area or try to move wires until the power has been turned off. Caution: electricity can travel from the power source through the person to you. Because of this, don't touch a person if they are still in contact with the power source. It's best to turn the power off, but only attempt this if you are trained to do so. Once the power is off, you may touch the injured person. Actions to take for an electrical injury. Make sure the scene is safe. Get the first aid kit and AED. Wear PPE. Phone 911. When it is safe to touch the injured person, give CPR if it is needed. A healthcare provider should check anyone who has an electrical injury as soon as possible.